don't really know me, my name's Jackie Hyam and I'm the Business Development Manager here. And we hear lots at the moment about social prescribing, navigation or whatever, so we thought we'd have just a sort of short period of time when we actually try and understand what all these different words around social prescribing really means. We'll start off with a short clip that I have repurposed from YouTube, always really, really useful.
Many things affect your health and well-being. GPs tell us that a lot of people visit them feeling isolated, lonely, or stressed out by work, money, and housing problems. These are issues that can't be fixed by doctors and medicine alone. At its most basic, a social prescription offers the kind of help that doesn't come in a tube or a bottle. The idea behind social prescribing is to help you to have more control over your healthcare and find ways to manage your needs in a way that suits you. There are lots of different ways of providing social prescribing services. It often starts with a conversation, perhaps with a link worker, a support broker, or a community navigator. Whatever they are called, they are there to listen to you and put you in touch with whatever it is you might need in order to feel better. That might mean being introduced to a community group, a new activity, or a local club. It could be legal advice, volunteers to help around the house. It might just be information and guidance, a bit of inside knowledge on your situation and what local resources there are available. It could even be some support in how to create something new. Studies show that individuals with social prescriptions get better and feel better faster than those treated with medicine alone. And because it works, it's happening more and more. To find out how it can work for you, talk to your doctor, health professional, or local authority today.
Okay, and I thought that was a really good, clear idea of what social prescribing is or can be. I really like this diagram here. I think what we should all understand is social prescribing isn't a new thing, and as a community-based organisation, I think it's probably also known as helping people with compassion and understanding, which is what we all are here to do. It's called many different things in many different settings, and it works in different ways in those different settings. Hertfordshire chose to be perhaps early adopters of a social prescribing model through their community navigator scheme, that is now slightly morphing really into their link worker scheme. But this diagram here is a great way of explaining the real breadth of social prescribing across the whole of our community. The bit we're talking about really with link workers is this little bit on the left-hand side where there's these sort of links that are linking people with people, people with places. They might be called community connectors, as I said, they might be called community navigators, but it's all about that really human connection that I think has got lost along the way. I think perhaps COVID has brought it back to the fore, and we're all thinking much more about that connection and how we need that human interaction. But what has been proved is that connecting people to their local communities and local individuals supporting other individuals, that it really, really works, and people's health and well-being improve because of that. They're connected back in their local communities. Long gone are the days when people used to turn up when you were ill and take your kids and look after your soup and bring you soup and things like that. But it is getting back to that thing about knowing each other, how we might need support and where to ask for support, because I think that's where some of this has got a little lost along the way. Right. In plain English, social determinants of health, because I've repurposed also some of this, is really that the non-medical factors that influence our health outcomes, whether that's housing, jobs, work, life. It all has an impact on our health and well-being. When we talk about health, we normally talk about healthcare, hospitals, the NHS and GPs, but not about what keeps people well. We talk about it and the fact that people are ill and they need these services. We're talking about wanting to keep people well. And as the figures say here, you know, only 10% of an individual's health and well-being is linked to access of that health support and service. And that's a tiny, tiny amount when you think about it. So being healthy is more about not being ill. Lots of things affect your health. It could be housing. You know, you wouldn't necessarily think about going to see your GP about your housing situation, but housing, I think, certainly for me, is one of those big, big things that has an impact if you're living in cramped conditions, poor heating, poor ventilation. That has a huge impact on your health and mental well-being. And that's not something that the NHS can help you with. That you have to be able to be connected into other services like the local authority, local charities, and different sorts of support to be able to get that. I think struggling to pay bills, this is where we're thinking about citizens' advice and some of our other community projects. Bereavement, housing issues, these don't naturally mean that you think you're going to go to your local GP to get help, but they're all things that drag us down, and we are all struggling with our own mental health at the moment post-COVID. So if you haven't got the strength on that particular day to sort that out, you know, where do you go? Where do you go for that help? So it's about those social connections that really do make a difference to our mental health and well-being. So, I'm very impressed at the PowerPoint works going on, so thank you, Shelley. So anyhow, so in thinking about social prescribing link workers in particular, they're based in primary care. So primary care is in our GPs, and the link workers work with a group of GP practices called primary care networks. Now, primary care networks are quite a new thing, came about in 2019, and everybody bandies about the word PCN. So when they're talking about a PCN or something to do with a GP, they mean a primary care network. So it's a group of GPs who work together. And alongside those primary care networks came the NHS funded link workers, and they were allocated funding for a certain number of link workers in every primary care network. So the link workers support the people who were referred to them. Typically the referrals will come from healthcare professionals within that GP practice, but it could be that they're referred from a range of partners outside, citizens' advice. It could be even here at CVS that are referring an individual to a link worker because they know that they need that support. And the approach is really, really simple. It's about that human-to-human interaction. It's about giving that individual the time they need to unpick what help they need. It's a bit of an oxymoron, really, isn't it? Because it's not prescriptive at all. It is actually listening to the individual in the middle of this care and trying to work out what's the best pathway out, whether that's connecting them to health services if they have got a health issue, or more widely, connecting them into the community. I think the evidence has shown that it works best for people who have a range of problems. If you've got one problem, you can go to one particular agency, whether that's the GP, the local council. We've all been bandying about for a number of years about multi-agency working. I think perhaps it's only truly in COVID that's come along and that we've actually learned how to do it. We've all had to put our egos to one side. But actually, when we're talking about social prescribing, it's the most helpful for these groups of people that I'm not even going to try and read the bulleted things. So, let's see. Just a bit of background, I was saying about the primary care networks came into being in July 2019. Always interesting to see when money gets put behind something. I think Susan and I first went to a presentation and we thought, gosh, that's an awful lot of money they're investing in this. Hertfordshire, like I said, had already got a bit of a headway on this with their community navigators. But I think the situation's changed and navigators are now there to support directly referrals from Hearts Help. There are these link workers in the GP surgeries where the problems are directly referred to the link workers from the primary care networks. Whilst these figures are nationwide, you can see the increasing numbers because you've got, by December 2019, you've got 300 link workers in primary care networks. And, you know, it's growing. And then where are we by April 2021? I think we're at, 1,000 link workers out in our community. Do we know who they are? Do we know how to use them? If there's a scenario where you think somebody needs help, have you got their contact details so that you can refer them in? We should, as a community organisation and sort of voluntary community sector, be using those connections to make sure that people get help in the right places. And I think the primary care networks have expanded their use of link workers, so you now get mental health link workers, you get a child and adolescent mental health workers, so they're specialising in different areas and linking in then with Hearts Help and the Community Navigator Scheme. I tried to look at the future of social prescribing. I'm a bit of a cynic when it comes to funding and the voluntary and community sector, but I think a big thing for me is about learning about what works in what settings. I think the NHS really do have to think about, instead of just constantly funding link worker after link worker, I think they really do need to be thinking about how does that work and look at the impact of the different models in the different communities, because communities, we're all different and therefore we all have different needs, and one size isn't necessarily going to fit all. And this is where the cynical bit in becomes. The partnership between the NHS and the voluntary community sector, social prescribing doesn't work without voluntary and community sector support. You know, if they hope to continue to roll it out, they also have to spend time and energy in developing that partnership model. They can't do it without us. And I think this last bullet point is getting even closer to my heart, and I'm going to get on my soapbox, because I think going forward, voluntary community sector, you know, you saw on the accounts with an enlarged designated fund for BEH. Voluntary and community sector income is going to fall and access to grants is going to fall as everybody tries to reconcile the huge sums of money that's been paid out during COVID. But actually the need for the sector has increased. And in order for this support to continue, the money does have to follow, because small grassroots organisations can't cope with the number of people being referred into them whilst they're focusing their energies on finding funding or supporting volunteers. All those things are not free. You know, there needs to be a formula where the voluntary and community sector can be funded for the number of people that are referred through from the link workers. And we shouldn't ever forget that, because we are being asked to support. But I think my rallying cry possibly is over. I'm sure the presentation is going to be sent out at the end of this, but these are the social prescriber contacts in our local area. If you're working in a small community and you're close to one of these, drop them an email, get an understanding of what they're doing and how you can help, because we do need to join the dots, and we need to make sure that these people who need our support have the support in their local communities. So we need to identify ourselves as being able to do that. And just a couple of links to where you might look to see what the NHS are planning for us all in the future. So, thank you.